Hi guys, good day. This is Jericho Arceo. So, andito po ako sa CSA and blessing po kasi I've had skin problems, no? So, last week, binigyan ng treatment yung back. And for today, gagawin po natin is ita-try natin yung Hollywood laser peel. Yeah, so ayun, hopefully no, pag katapos po nito, magmukha akong Hollywood. You know what I'm saying? Let's go! At bago po kayo umalis, please do not forget to click like and subscribe sa YouTube po ni Dr. Contessa Salvador Alapag. You know what I'm saying. Thank you guys. God bless and let's go.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. He's an influencer, and I heard he's a famous vlogger. Let's all welcome Mr. Jericho Arceo. Yan.
Hi, guys.
Balita ko kasi famous ka daw eh.
Maling balita.
Actually, I saw him on this Netflix Filipino film. And then it so happened there was a name Jericho Arceo. And in my mind, is this the Jericho Arceo I know? And then I was watching the Filipino movie and then waiting for Jericho Arceo to come out. And then I saw him. He's a tall guy, okay? Like a friend of the guy there. And then what I noticed was the pimple or the acne over the jawline area. Even the upper neck area.
Yeah.
It was so visible on the film, but overall, you look great.
Yeah.
He looks great. And so, actually, I messaged him. And wow, what a coincidence. I have a new device that will also help in getting clear or rather treating those acne concerns and at the same time, the acne marks. Right?
Right.
All of a sudden, I had that device and he was the one I saw on that Netflix movie.
Wow.
Good thing you came out there, right?
Coincidence, Doc. No?
Yeah. And plus, Jericho is how young are you?
I am 26 years old po.
Yeah. So, actually, the acne is a teenage problem. Problem of the teenagers, so you're still a teenager.
Yes. Doc.
Anyway, but there's like a percentage that some teenagers, like when they reach the age 20, they still retain the acne conditions. So it could be from genetics, lifestyle, well, diet, according to studies, indirectly, okay, when you have this high glycemic diet, it will increase the insulin level and at the same time, the insulin goes to your skin and triggers those sebaceous glands. And activity of the sebaceous glands, like you overproduce oil, it clogs the pore and will lead to pimples. So, yun, genetic, lifestyle, indirectly yung food. Kasi we were discussing also about food. And other factors, like even the hormones, the androgen hormones, and even for women, the hormonal thing. And those who are using some products on their face, some products can be comedogenic or acnegenic, okay? And other factors. Meron pang tropical acne. Have you heard of tropical acne?
Just now, Doc.
It's in the tropics, okay? That's common among like US military when they go to like tropical countries. They develop some tropical acne, especially on the back. Yan.
Oh, I think I have that.
Tropical acne, cosmetic acne, and other types of acne. Meron pang acne universalis. Ayun. So several types. Yeah, several types of acne conditions. That's why here we do also do an evaluation of the kind of acne you have or even the stages of the acne. So many things to learn actually in this field. Actually, we have a book of acne. One book lang yun, acne. Okay.
It's about my life.
Okay. So actually, we're here to help Jericho also, you know, get rid of these concerns on the skin. And as much as possible, we want to have that clear skin, blemish-free, pimple-free skin. Even those pores, you know, we wanted to make the pores kind of so closed pores. Okay, though we have pores in our skin, okay, we just wanted them to be like not so enlarged, you know. We just want to make them tightly closed, okay. And yan, even skin, balanced tone, and yan, pag celebrity skin, right? Yeah, it's not that you have a lot of a problem, okay, but these things are like not so
Good. It's not so good.
yeah. Yeah, kasi like I had a kid also like having this teenager kasi acne, and then conscious din kasi siya in the school. So it kind of affect their psychological aspect, right?
Yes, ma'am.
So, yan, marami kasing mga young ones right now affected by these acne concerns, acne scars. So we have a treatment here that will, you know, target that and help you out, those with these kinds of concerns. So, how are we going to treat Mr. Jericho here? We'll show you when CSA Medical Aesthetics return. And we're back. So we're doing a treatment for Jericho. We have now here our Hollywood Laser Spectra device, okay? So this is the one that we will use to treat those acne concerns, even the acne marks, okay? Even those open large pores, we can use this device. Now, the protocol that we will be applying will be the so-called Hollywood laser peel. It has a three-step mode, three-step procedure. So the first one is to use the Spectra mode, okay? Prior to that, we did apply the so-called Carbon Spectra lotion, okay? This is only specific for this device. So this is like a charcoal that we apply. Leave it on ideally like around 15 minutes. Have it like seep into the skin so that it will bind or adhere to the stratum corneum layer of our skin, okay? So that we can have this so-called epidermal turnover or exfoliation, okay? So I'll be using my goggle where I have to wear this protection for my eyes, and even Jericho here has an eye protection. So I have the handpiece here, okay? So this is the collimated tip handpiece. We call it the collimated type because it has several hand pieces also. We have the MDF, the ruby, and the gold. So this one will use the collimated tip. Now, we have here in the screen of the device, okay, we call this GUI. So it has this operation mode, meaning to say what are the wavelengths that you will be using. So I'll be using the first one, 1064 Spectra. That's the 1064 nanometer wavelength. Then we go with the spot size 8 and then the pulse rate 5. And our energy or fluence is 0.9 joules per centimeter squared, okay? So I'll be starting now. So this is the first step in this Hollywood laser peel. So the goal of this one is to stimulate our skin, okay? So Sir Jericho, some heat sensation only, okay? I'll start on the lower part, your chin part, okay? You're good? Okay. No pain, right?
No pain.
Okay, good. So I'm just gonna be irradiating the areas where we have this carbon lotion here, okay? And this is the Spectra mode 1064 wavelength. The goal of this one is to stimulate the skin. So it delivers a so-called photothermal effect. And it helps the carbon to adhere in the dead cell layer of our skin. So this is the step 1 Spectra 1064 mode in 300 microsecond pulse duration, okay? So very precise, Jericho, okay?
Oh.
So this is science, Jericho, okay?
Wow.
Yes, heavy science. So there's this laser beam that targets this skin layer. Actually, Jericho, laser is an acronym. So again, it stands for light amplification by stimulated emission of radiation. The one who theorized that was Albert Einstein. Okay, so our scientist in the past. Si Jericho, baka modern scientist ka na rin. Okay. So we've done the first step, okay? Now, second step will be the so-called the 1064Q switch, and we're using the same parameters, spot size, pulse rate, as well as the fluence. And this one now has a loud sound, Jericho, okay? So it's like this part here will be, what do you call that? Erasing yung carbon lotion. So it will fade, it will disappear, okay? With this second step, okay? So there's a loud sound, Jericho, okay? So wag ka na lang mabigla, okay? So we'll start with the chin part. So first shot lang, medyo loud lang. Okay, you're okay with that? So that's just it. Parang firecrackers, no? Okay. Kayang-kaya? Okay. So we'll just irradiate the one with the carbon lotion. So this one instantly erases the carbon lotion. So the goal of this one is exfoliation and also targeting the pigments, like the pigments from the acne. So this will clear up our carbon lotion. So I'm working on the right side of Jericho's face. And you can actually apply multi-passes for this one. They copied this patent of this company. So we have just done the right side of the face. Let's go to the opposite side. Okay, third step. So we have done our step 2. Of course, after step 2, step 3. Okay. So for the step 3, we'll be going back to the Spectra mode again, the 1064 and same spot size 8. We can actually make the pulse rate 10, and this is 2.4 fluence, or the energy delivered to the skin is going to be 2.4. Oh, there you go. So I'll start with this. So this one is already like a multiple passes or multi-pass procedure. Okay, ready? So this is okay now, no? Doesn't hurt?
Hindi masyado.
Hindi masyado.
Hindi po.
It's kind of like pricking lang, no? Or something is on your skin, but it's fine.
Yeah.
The others are telling me it's like ticklish daw eh. Some people have this sensation na ticklish daw siya. So, it depends talaga on ano.
Hindi mo warm yan.
Warm, yeah. So, it's kind of like also for others, it could be tickling, or others like there's pricking or heat sensation. Or the others are saying nothing, there's nothing. So, individual variation when it comes to the like reaction or response to any skin stimulation. The varying response of every individual. Okay, so we've done the 3-step procedure of the Hollywood laser peel. Right now, this device also have the MDF, or the so-called multiple depth focus or multi-depth focus. So we'll be changing now the handpiece from the collimated handpiece, zoom collimated, to the MDF handpiece, okay? So the MDF targets acne scars, acne marks, or even enlarged pores. Or we can also use the MDF for like skin rejuvenation, anti-aging, those with concerns of like loose skin or laxity of the skin, or some fine lines, wrinkles, or any like even epidermal pigments. We can use this kind of handpiece, okay? So again, the device has 4 handpieces. We have the gold, the ruby, and it also has the zoom collimated and this MDF that we are using right now specifically for enlarged pores as well as the acne scars or acne marks, okay? So for like, we can use this for skin rejuvenation, anti-aging, as I've mentioned, as a base. We can start with that all over the face. But since we've done Hollywood laser peel, what we're gonna do right now is just target enlarged pores plus the acne scars or sunken scars, atrophic scars, okay? How are you, Jericho?
I'm okay, Doc.
You're still okay. So this one, it has certain like parameters that we follow, the operation mode, or the wavelength, what spot size, what pulse duration, what will be the fluence. Okay, so my assistant here is already preparing for it. So we're starting with enlarged pores. Okay, enlarged pores. So assessing the skin of Sir Jericho, we notice that in the mid-face section, usually it's in the mid-face that we see enlarged pores, okay? And cheek area, or even the lower part of the face, you can see those pores obvious, very obvious, especially here. So we will target the mid-face section, Jericho, okay? Now, I have a spray. It's called Pain Freeze. It's something very cold, or freezing cold, Jericho, okay, to numb the skin, okay? Or you can actually apply numbing cream, leave it on for half an hour, but this one is an instant numbing. I just will spray onto the skin, okay? Malamig lang siya, Jericho, ha? You're okay?
Opo.
So I'll start with the right side here. So we have the step 3 mode or step 1 mode. Step 1 mode, okay? So this one is a device, actually, this is the latest of the Hollywood Spectra device that they have this kind of piece. The tip. Okay. So first shot, okay. How did that feel?
Ano po?
Prick?
Yeah, prick.
But tolerable. Okay. So it's a fractionated type of laser resurfacing. Okay, if you don't have the CO2 fractional laser, you can already use this. So I can actually add more spray, so it doesn't really feel that too much of like a prick. Okay, parang tusok, no? Okay, so shot again on this one. It's like spraying our fractionated laser beam, and then we'll proceed with the opposite side. Turn to the right po, please, and spray again. So I have this Pain Freeze, okay. And then we'll be looking at some of the acne marks that you have. Usually the acne marks are in the lower part of the face, right, Jericho? Okay. So again, shot here. It's like a fractionated laser. So there you go on the mid-face section. Okay, now I'll be looking at the acne marks that we have on the lower face. So we'll be changing step 1 also, but I think your spot size is lesser because we'll target just some sunken scars or atrophic scars. So for those who have concerns of like they only have few acne scars on their face, few acne marks on their face, you can actually use this kind of fractionated laser, MDF, of your Hollywood Spectra, okay? So like, for example, I saw here like an atrophic scar or sunken scar. You can just target that, do a single shot of it. Is that okay?
Yes, Doc.
Okay. And do like a stacking of those pulses, okay? So it's just like another firecracker again, okay? And actually, the end point of that one is to have the PTK. We'll do the other side. So this is a simple technique, okay? So I have patients who come to me, Doc, I only have like a pock scar on my nose, on my forehead, on my cheek, on my jawline, okay? So we can just target them individually, not necessarily the whole face, okay? Because with the Hollywood laser peel, we know we don't have a downtime with the Hollywood laser peel. But this one, because we want to achieve a so-called PTK, so there's just like a mark of the grid mark from the laser. Okay pa siya? Okay. So, you have more on the other side. Okay. So, there you go. One more here. And there you go. We've done the combination Hollywood laser peel with the MDF using our Hollywood Spectra. We'll show the result to Jericho when CSA Medical Aesthetics return. We're back, so we'll now show the result to Jericho. And Jericho, it's normal that you have some redness on the cheek area because we did use the MDF that has the endpoint of erythema. We call it erythema or redness, okay? And that's normal because we did try to treat the enlarged pores in the mid-face section, okay? And then we also did some shots on the acne marks, sunken scars, using the MDFD step 1 mode of that one, okay? But the overall, the Hollywood laser peel, actually that one has no downtime, okay? If you have an event like a party or whatsoever, then the Hollywood laser peel is the best one for you. But for those who have concerns of like there are some scars there, we can treat it right away directly. Just target it with the MDF treatment. So this is an additional handpiece for our Hollywood Spectra. So how's the experience, Mr. Jericho?
It's ano po, very first I was very scared po kasi it's my first time doing the laser.
Right.
Pero duration po, it's very tolerable.
Yeah.
And I'm born again.
You're a new Jericho. Okay. So there you go. So in terms of the experience, okay, my patients are telling me that they feel that heat sensation because the photothermal has a certain temperature there, okay? So we wanted to have that kind of thermal heat to stimulate the skin as well, and plus stimulate collagen formation, your fibroblast cells to create new collagen, elastin, and other important connective tissue components, okay? So it's also anti-aging and rejuvenation. There you go. Plus, it also targets some of the pigment molecules there to lighten, to reduce those dark pigments there. And this has to be done in sessions, okay? The thing with us Asians, Filipinos, we're in the dark skin color type, the so-called Fitzpatrick type, because we have classifications of the color of skin from 1 to 6. So we belong, the Asians, 3, 4, 5, that's where we are. Now, the darker the skin type, the more sensitive when it comes to these laser devices or these energy-based devices or anything that emits heat. We tend to react in a way we darken more. So that's why there's a certain protocol, parameter that we follow, yung tamang timpla for our skin. For white skin, we can even use higher energy for them because they don't have that much of the melanin pigment that react to this kind of devices. So with Asians, we do it in sessions. Gradual lang po, slowly but surely. So safety is important also. It's important that you go to trained practitioners doing these kinds of laser procedures because there are also like contraindications. There will be like complications if it's done incorrectly. Okay? So we do studies, we kind of like attend conferences, seminars, workshops for this laser treatments. So hindi lang siya basta-basta kahit kanino binibigay. No, it's not like a one treatment for all. Iba-iba yan. So we also diagnose the skin condition, okay? There are indications, there are also contraindications. So added input. Yan, okay. Thank you so much, Sir Jericho. So we'll do some follow-ups with you because like 2 weeks ago, right? We did treatment. We had to control some of the active acne. We've given him Epiduo for the acne lesions, those inflamed acne, and good thing that they kind of like subsided.
Yes.
They responded to the treatment. So you're a responder. Thank you. Okay, so if you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos in our YouTube channel, Contessa Salvador. Sir Jericho, do you have like an Instagram that they can follow or social media account that they can follow you?
Doc, grabe, I'm amazed by your spiel, but you can follow me. You can follow me on my social media accounts, Jericho Arceo. Yun lang po.
Yan, and that's glory to God,
Glory
okay?
to God.
So, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.